Anadrol. Anadrol, or oxymethylone, is a steroid that was originally made to help treat severe anemia, particularly in cases where people had problems making enough red blood cells on their own. Doctors discovered that Anadrol helped patients' bodies quickly produce more red blood cells, which meant more oxygen could be transported throughout the body. This made it valuable for people whose low red blood cell counts left them weak, tired, or unable to recover from illness. For a short time, some doctors also used it to help AIDS patients and elderly people regain strength and muscle. But what makes Anadrol powerful for people with medical conditions also makes it tempting and risky for athletes and bodybuilders. Anadrol is known for causing some of the fastest muscle gains possible. In just a few weeks, users often notice a dramatic increase in muscle size, weight, and physical strength. Muscles appear bigger, fuller, and often pushed out by a strong pump during exercise. These rapid results are a major reason people are drawn to the drug for muscle or sports performance. Unfortunately, the same qualities that make Anadrol so effective also make it one of the most dangerous steroids out there. One of its biggest dangers is toxic stress on the liver. To work as a pill, Anadrol is chemically designed to survive being broken down in the stomach and liver. However, this protective change means it's extremely harsh for the liver to process. Even a short time using Anadrol can cause the liver to become inflamed and start malfunctioning. Symptoms like dark urine, yellowing of the eyes or skin, known as jaundice, stomach pain especially on the upper right side, and overwhelming fatigue can be early signs. If use continues or doses are high, the liver may develop larger problems like tumors or, in worst cases, liver failure, which can be fatal. The problems don't stop at the liver. Anadrol causes the body to hold a lot of water. Most users look puffy or bloated, and muscles appear round but soft. This water does not just stay in the muscles. It spreads throughout the body, increasing blood pressure. High blood pressure in turn puts stress on the heart and blood vessels, raising the risk for dangerous heart attacks, strokes, and, over time, heart failure. For people with family histories of heart disease or high blood pressure, the risk climbs even faster. Anadrol creates hormonal havoc too. Though it doesn't directly convert into female hormones, it can act like estrogen in the body. This means men sometimes grow breast tissue, a condition called gynecomastia, experience swelling in their nipples, or have fluid collecting under the skin. At the same time, Anadrol tricks the body into shutting down its own natural testosterone, which is necessary for sex drive, fertility, energy, and normal mood. Men who use Anadrol, even for short cycles, may notice their testicles shrink, their desire for sex vanishes, and it becomes difficult or impossible to get a normal erection. If misuse continues over time, it can cause long-lasting or even permanent changes. Women are especially vulnerable to certain side effects, experiencing deeper voices, irreversible facial or body hair, changes to their sexual organs, and lasting changes in their periods. On top of this, Anadrol can badly affect mental health. Many people notice wild mood swings, including unexpected bursts of anger, sometimes called roid rage, anxiety, restlessness, trouble sleeping, and even depressive lows. Headaches and nosebleeds are common, and for those who already snore or have sleep apnea, the water retention can make sleep much worse. Anadrol's negative impact on cholesterol is also severe. Good cholesterol drops, bad cholesterol rises, and the blood gets thick, creating the perfect storm for clogged arteries and possibly sudden cardiac events. Serious infections become more likely, and stomach problems like nausea and vomiting can happen as well. Because of all these severe health risks, especially its threat to the liver and heart, Anadrol is banned in all major sports and almost never prescribed except for rare, life-threatening medical conditions. It's one of the most dangerous steroids used outside of supervised medicine. Trenbolone. Trenbolone is a steroid that was never intended for humans. It's actually a drug designed to pump up cattle, making them grow more muscle before going to market. However, despite its origins on the farm, Trenbolone somehow found its way into bodybuilding and athletic communities, where it quickly became infamous, not for safety, but for how powerful and unpredictable it is. Trenbolone is considered one of the strongest steroids known for building muscle and losing fat at the same time. People who use it commonly report not just muscle gain and fat loss, but an uptick in body temperature, increased aggression, endless energy in the gym, and faster recovery. However, as impressive as the gains might be, the side effects are notoriously nasty. One of the main dangers is its effect on the heart and blood vessels. Trenbolone drastically lowers good cholesterol and raises bad cholesterol, which speeds up the development of plaque in the arteries. This process can make heart attacks or strokes much more likely, even in people who are young or otherwise healthy. It also raises blood pressure, putting terrible stress on the heart, increasing the chance for damage or sudden cardiac events. Trenbolone is harsh on the kidneys, making these delicate organs work overtime and raising blood pressure within the kidney tissues themselves. Over time, this strain can contribute to kidney injuries or even permanent loss of kidney function. Urinary problems and kidney-related pain are warning signs, but damage may go unnoticed until it's severe. One of the weirdest side effects, known as tren cough, happens when users inject the drug and accidentally hit a tiny blood vessel. When a bit of the steroid gets into the bloodstream instead of staying in muscle, it can trigger a sudden, painful, racking cough, the kind that makes some people panic, gasp for air, or feel like their chest is being squeezed. This cough, while usually short, is frightening and a clear sign the drug is not meant for people. Like most steroids, Trenbolone messes up the body's natural hormone balance. It doesn't turn into estrogen, but still causes strange sexual side effects: loss of sex drive, erection problems, sometimes even enlargement of breast tissue in men due to increased prolactin, a hormone the body makes. For women, even tiny amounts may create long-lasting changes: facial and body hair, a much deeper voice, changes in body shape, and missed periods, effects that usually do not go away after stopping. Mentally, Trenbolone is notorious for causing irritability, anxiety, paranoia, and serious emotional swings. The Tren Rage stories, about people flying off the handle for no reason, come directly from users' accounts, and withdrawal can drag people into months of depression, fatigue, and foggy thinking after they stop. Another odd danger: the muscles may get so strong so quickly, while tendons and ligaments lag behind, that users often get painful injuries, many involving the tearing of tendons or muscles during regular workouts or competitions. Given this torrent of physical, mental, and emotional risks, Trenbolone is widely recognized as one of the most unpredictable and dangerous steroids, both by former users and by medical experts. It's banned by sports organizations everywhere. Dianabol. Dianabol, also known as methandrostenolone, is famous as the first oral steroid to become widely used in sports. It was originally made to help American Olympians compete with Soviet athletes in the late 1950s and 1960s. The most remarkable thing about Dianabol, how quickly it can add muscle size and strength. Even within a few weeks, users report major weight gain, harder workouts, and muscles that look and feel larger. But along with rapid progress come lots of drawbacks. Dianabol easily converts into estrogen in the body, leading to lots of fluid retention, so muscles feel big, but soft and full of water. Faces get puffier, and joints sometimes swell. There's also a major risk of developing breast tissue in men, gynecomastia, feeling emotionally unstable, and dealing with increased blood pressure. Dianabol, like many oral steroids, is very hard on the liver. Taking it, even for short periods, can lead to the buildup of toxins in the liver, which must work over time to break it down. Prolonged use can cause liver inflammation, pain in the upper right abdomen, yellowing of the skin and eyes, and severe fatigue. More serious risks include the development of blood-filled cysts in the liver, and, rarely, tumors or even cancer. On the hormonal side, Dianabol sends a signal to the brain and pituitary gland to stop making the body's own testosterone. This leads to testicles shrinking, loss of sperm production, sexual dysfunction, and mood issues. After stopping, it can take months, or even longer, for normal testosterone production to return. Some people may never recover fully without medical help. Dianabol also messes with blood fats, lowering good cholesterol and increasing bad cholesterol, raising the risk for heart attacks and strokes. Muscles may outpace tendons and ligaments in their ability to handle strength, resulting in sharp cramps, muscle pumps, painful swelling especially in the lower back and shins, and frequent injuries during lifting. Emotional side effects are also common: euphoria, irritability, anxiety, insomnia, and eventually a kind of withdrawal that leaves users chasing lost strength and motivation. Because of these side effects, Dianabol is banned in nearly every sport and is very rarely prescribed in medicine today. Stanozolol. Stanozolol, best known under the brand name Winstrol, became famous after being used in the infamous 1988 Olympic doping scandal. Athletes liked it because it made muscles look sharper, leaner, and gave a hard, defined appearance. Unlike many other steroids, Winstrol doesn't cause much water retention, which is why it's often used before bodybuilding contests. However, its safety record is poor. Winstrol is tough on the liver, especially when taken orally. Early liver injury might just manifest as tiredness or vague abdominal discomfort, but problems can quickly escalate to jaundice, fluid buildup in the belly, or even serious confusion due to the body's inability to clean toxins out of the blood. It also has pronounced effects on heart health. Winstrol lowers the good cholesterol needed to keep arteries clear, raises bad cholesterol, and leads to stiffer, thickened arteries prone to blockages, heart attacks, stroke, and blood clots. In some people, Winstrol encourages abnormal clotting, making conditions like deep vein thrombosis or pulmonary embolism more likely. Another unique risk with Winstrol is joint and tendon problems. While muscles might get bigger and stronger, tendons, which link muscle to bone, don't keep up. This imbalance can cause joint pain, frequent muscle strains or tears, and a higher chance of tendon ruptures, which can sometimes require surgery. Many users complain their joints become dry or achy, especially without sufficient water intake. Skin problems are another drawback. Acne often becomes severe, and anyone with a family history of baldness might find their hair falls out much faster. For women, the dangers are even higher. Lowered voice, increased facial and body hair that do not go away, menstrual problems, and permanent changes in body appearance are all possible. Chronic users also report mood swings, sleep problems, depression, and immune suppression. Winstrol is now banned in all sports and is rarely used in medicine except in very limited cases, like some hereditary diseases causing muscle wasting. Deca-Durabolin. Deca-Durabolin, nandrolone decanoate, has long been considered a gentle giant in the steroid world. Originally, doctors used it to help treat severe muscle loss, anemia, and bone diseases such as osteoporosis. It remains popular with athletes and bodybuilders because the muscle gains come steadily and side effects initially seem milder. But Deca has silent, long-term dangers. While it's less likely to turn into the type of estrogen that causes bloating or breast tissue growth in men, Deca attaches to the same receptors as progesterone, a female hormone. This can cause unique sexual side effects among men, namely the notorious Deca-Dick, where achieving or maintaining an erection becomes difficult or impossible, and no normal treatments work. Sexual desire and performance may drop sharply, and effects can last months after stopping. Like almost all steroids, Deca over time tells the body to shut off its own testosterone production, leading to low hormone levels, testicle shrinkage, and infertility. Women who use Deca risk permanent changes to their voices, sexual organs, hair growth, especially on face and body, and menstruation. Deca lingers in the body for a long time due to its slow-release properties. It can be detected in urine and blood for up to 18 months after use, leading many athletes to fail drug tests long after stopping. This long detectability has cost many their sports careers and reputations. Deca, too, is bad for the heart and blood vessels. It damages cholesterol balance, thickens artery walls, raises blood pressure, and increases the odds of heart attack and stroke. The kidneys work harder during use, and the risk of kidney strain or injury increases, especially with heavy training. Though musculoskeletal side effects are less intense than with Winstrol, long-time users still develop muscle imbalances, stiff or weak tendons, and an increased risk for rotator cuff injuries. Low energy, depressive mood, and periods of social withdrawal are frequently seen in long-term users, especially after quitting. Because of these problems, medical use is rare and highly controlled, and Deca, like others, is banned from all competitive sports. Halotestin. Halotestin, once prescribed for things like hormone imbalances, delayed puberty, or certain cancers, is now almost considered a relic of the past due to its high risk and low medical necessity. In the world of sports, it's been used by a handful of strength athletes and fighters for one main reason: it can quickly ramp up aggression, drive, and short-term brute strength. For some, it creates an overwhelming urge to compete or even fight, making it briefly attractive around contests. What makes halotestin especially hazardous is its incredible toxicity. It's more damaging to the liver than almost any other steroid, even when used in short cycles. Signs of trouble can include sharp pain under the ribs, yellowing of skin, dark urine, and a sense of sudden, unexplained exhaustion or illness. It has been linked to quick development of liver tumors, even in people who only used it for a few weeks. Halotestin is also dangerous for the heart. It rapidly lowers good cholesterol and increases bad cholesterol, raising blood pressure and making heart attacks, strokes, and sudden death much more likely. Like most steroids, it shuts down the body's own testosterone production fast, leading to sexual and fertility problems. The psychological effects are serious too. Irritability, insomnia, angry outbursts, paranoia, or even hallucinations have all been reported. Some people feel on top of the world while using it, only to crash into major depression after stopping. For female users, even low doses can cause deep, irreversible changes, voice deepening, changes in facial structure, more body hair, and changes to reproductive organs. Medicine has almost entirely abandoned halotestin because of these risks, and it is banned in all sports federations worldwide. Superdrol. Superdrol, also known as methasterone, became widely known in the 2000s as a supposed legal supplement for building muscle. It was falsely marketed as a prohormone, a kind of weak pill that supposedly turned into steroid hormones in the body, when in reality it is a full-blown, active anabolic steroid with no safety record. Superdrol is among the most notorious for damaging the liver. In just weeks, some users turned yellow with jaundice, experienced relentless vomiting, stomach pain, and in some cases needed emergency liver transplants or died. Even small doses can overwhelm the liver's ability to cope, and hospitalizations were frequent among users who thought they were just taking a safe over-the-counter supplement. The risks do not end there. Superdrol is devastating for cholesterol, tanking the good kind and raising the bad, putting people at major risk for heart attack and stroke. It also causes the blood to become thicker by raising red blood cell counts, which makes clots, heart attacks, or strokes even more likely. Testosterone production is all but shut off on Superdrol, leaving users with no sex drive, shrinking testicles, mood swings, muscle loss after stopping, and sometimes permanent hormonal imbalance. Brain and mental health risks are also pronounced. People experience anxiety, agitation, mood swings, memory lapses, and depression both during and after use. A further problem came from supplement companies selling Superdrol that was mislabeled, contaminated, or contained mystery substances alongside the drug. Many users took much higher or lower doses than they realized, amplifying the risks of sudden, severe organ failure. Superdrol is now a controlled substance, strictly banned in all sports, and recognized as one of the most hazardous steroids due to its unpredictable strength and rapid toxicity. Mibolerone. Mibolerone, known as Checky drops, was created solely to keep female dogs from going into heat. In humans, it wasn't designed or approved for any medical purpose. Yet, it found a niche in underground sports, particularly among fighters and powerlifters looking for a temporary surge in aggression and competitive drive right before a match. Mibolerone is incredibly potent. Just tiny amounts create profound effects on mood and body. Users report feeling aggressive and emotionally unstable, which could be disastrous for daily life outside strict competition. Even small doses put enormous stress on the liver, with users experiencing pain, enzyme spikes, jaundice, and a rapid slide toward life-threatening liver failure. It's less likely than most steroids to cause water retention or traditional man boobs in men, but it does cause hormone trouble by raising other hormones like prolactin. Sexual dysfunction and infertility are certain outcomes for anyone using the drug. And in women, even a single cycle can lead to lasting body and voice changes, as well as pronounced facial and body hair. Blood pressure often skyrockets on Checky drops. Headaches, vision changes, nosebleeds, and racing hearts are warning signs of life-threatening vascular problems, and kidney stress is possible if used with other muscle-building drugs. Due to the extreme intensity of its side effects, mibolerone is universally considered one of the most dangerous and reckless drugs ever used for performance. It is outright banned by medical regulators and in sport, with no accepted purpose for human health or sports. Like and subscribe if you learned something new.